are more open when it comes to their health than men. The men somehow, they don't talk about their health. And this particular thing that we want to talk about, according to studies in Nigeria, let me even limit it to Nigeria. In 2016, it was discovered that 57.4% of men suffer from ED. I'll tell you about it. And our doctor is already in the house to tell us about this. This affects the man in a way that maybe women, we may not be able to understand it deeply, but we also suffer the effect. But it affects them more because to them, this is part of what makes them a man. Tonight, we have a doctor in the house who is going to be telling us about it, because hope is not lost for anyone that is suffering from erectile dysfunction or impotence. The two are the same, erectile dysfunction or impotence. Dr. Oluranti Adekunle, in a short while, will be coming up to tell us more about that. And by the time we are done, I want to believe that help would have come to the men and, of course, to the marriage institution, because any way you look at it, when it affects the man in the house, the marriage institution is also suffering in a way. We hear a lot of things as pastors' wives during counseling. When you talk to couples and if you are very sensitive, you may be able to identify the cause of the problems they are having. It may be that the other room has not been active because of this problem. 57.4% in 2016 is quite a high percentage. So I'll be bringing on Dr. Oluranti Adekunle. Welcome back. Dr. Oluranti Adekunle is the CEO of Medispec Nigeria Limited. Medispec is a manufacturing company that specializes in cutting-edge medical equipment in the following specialties: cardiology, andrology, urology, orthopedic, nephrology, and aesthetics, using shockwave, radial wave, and microwave thermotherapy technologies. Medispec head office is in Maryland, United States of America. Dr. Oluranti is a graduate of College of Medicine, University of Ibadan, a member of the American Society of Sexual Medicine. Dr. Oluranti Adekunle is a sex therapist, so his experience in counseling on the issues that concerns the other room. Ladies and gentlemen, please join me to welcome Dr. Oluranti Adekunle. Doctor, good evening. Thank you so much for honoring our invitation.
It's a great pleasure to be here. And let me start by profusely thanking the Orchard International for inviting me to be one of the guest speakers tonight. It's going to be a wonderful night for each and every one of us. And I hope at the end of the day, everybody will have something to take home by the grace of God. Thank you very much.
Thank you very much, Doctor. On this topic at hand, we thank God that experienced men like you are in this field to be able to counsel men, because men are usually shy when it comes to issues like this. But tonight, please, we want you to lay it bare so that many of our men can benefit from this talk. I spoke about, before I added you to the stream, about what I read in a 2016 study in Nigeria, that 57.4% of men suffer from erectile dysfunction. What exactly, sir, is erectile dysfunction?
Thank you very much.
In the layman's language.
Yes, I will. Erectile dysfunction is repeated inability to keep or have a strong erection firm enough for sexual intercourse. Let me come again. repeated inability to keep or have an erection strong enough for sexual intercourse. It could be total inability to have an erection. It could be inconsistent ability to have an erection. That is, the man has an erection, it doesn't last. And it could be that there's a tendency for the man to have an erection. And usually in sexual medicine, there's a timeline for this. It's usually within 6 months. We talk about it. So erectile dysfunction and impotence, they are the same thing. Let us clarify that, like you said. It's just repeated inability to keep or have an erection strong enough for sexual intercourse, which could be total inability. That is, the man is not having an erection at all, or the erection comes on, but it's inconsistent. That is, he has strong erection, but it's not consistent. Or there's a tendency to have an erection for a short period. And usually there's a timeline for it, which is usually 6 months. That is essentially what we call erectile dysfunction.
In other words, if it just happens maybe if it happens once in a while that the man is not able to achieve a strong erection for sexual intercourse, it doesn't mean that a one-time thing that the man suffers from erectile dysfunction. Hello,
it
sir.
has to be repeated. It has to be a repeated incidence.
Okay.
A repeated incidence. So,
okay. So if it's consistent,
it doesn't matter,
like
it could be
6
2 or
months.
3 times, 6 months.
Okay. Okay. Thank you very much, sir. From what you have said now, erectile dysfunction and impotence, they are the same thing. It's just another word.
Absolutely.
So what is the cause of erectile dysfunction?
Erectile dysfunction, there are so many causes, but basically they are into 2 forms. We talk of organic and inorganic. Organic in the sense that it affects, is caused by health-related diseases like diabetes, heart-related diseases, then cases like previous surgeries of radical prostatectomy, then pelvic injuries, that is, radical prostatectomy is surgery of the prostate from cancer of the prostate. The surgeon goes in, they move a lot of things apart from the prostate around. There are some tissues around the prostate.
That should be due to network challenges. Doctor will join us again. But so far, what he has told us is that erectile dysfunction and impotence, they are one and the same. And that a man is not able to get it up once, twice, thrice, does not mean that he's suffering from erectile dysfunction. It has to be a repeated condition or incidence for like 6 months, then you can't say that this man has erectile dysfunction. Doctor is back in the studio.
Yes.
Sorry Welcome back, sir.
I said they are organic and inorganic. I was talking about the organic, that is health-related issues. I've talked about heart conditions, hypertension, diabetes mellitus, then pelvic injuries, some surgeries. Then inorganic, which is not related to any health issue, anxiety, depression, feeling of guilt, could be a cause of any one of those, could be a cause of erectile dysfunction. So it's either organic or inorganic. But we found out that over the years that the people who have organic problems, right, because they are not able to perform, depression sets in, anxiety sets in, the feeling of guilt sets in. So you just need to counsel the patient very well to know where the patient falls in. So you can have a patient having the two together, both organic and inorganic.
Okay.
Yes.
How do they affect the self-confidence of a man? How is the marriage affected by this?
You see, the issue is that it brings a lot of problems in homes. It is the self-esteem of a man to have an erection. And once that is not there, any slightest issue in the home, the man feels because he's not been able to perform. That is why the woman is not able to respect him. And somehow we are getting to a trend in the society now. We discover that a lot of younger men have this issue, and it's causing a lot of problems in newly married homes,
Wow.
which is very, very frightening. We are talking of men in their 30s, a lot of men. You hear that they have issues at home here and there, but deep within, you find out that they have this problem, underlying problem. The man has erectile dysfunction. He believes he's not being respected at home. And usually the woman might have her own reason for behaving one way or the other. But once the woman is not able to perform properly in the other room, the self-esteem in the home is gone and it's bringing a lot of problems. That's why I said I really thank you for bringing up this topic because people don't want to talk about it, but we see quite often that it's creating a lot of problems in homes, most especially the young families. The older families can understand. Most of them can cooperate, but the younger ones is a big, big problem, which most people don't know that younger men have this trouble problem. It's very, very alarming. We see it in men in their 30s nowadays.
Hey, are you saying that older men suffer from it more than younger men? And
Yes,
what is
yes,
causing this? If older men are the ones that are supposed to suffer it more, why the
yeah,
prevalence in young men in
yeah.
Nigeria these days? Has it been identified? What is
Eh,
causing this?
that's a very good question. You see, what happens is this. Normally, um, what we are discussing, you know, there are different pathways through which a man can have erection. You have the blood supply, you have the nerves, you have the hormones. But the blood supply is the major cause of erectile dysfunction. If the blood vessels, the caliber of the integrity of the blood vessels are compromised, the blood flow to the male organ will be compromised too. Normally, the diameter of the blood vessels going to the penile region, male organ, very, very small. So in older men, what you have is that because of age, the integrity of the blood vessels are compromised. Thereby, the blood flow too will be compromised. If the blood flow is compromised to any part of the body, it will be mostly affected in the male organ because the vessels there are tiny. So you have it more in the older age group,
From what
usually
age are we considering as older men now, sir?
um,
From what age? Which age range are you?
yes, let me say categorically, if you are going to go by WHO standard, you say you give a statistics that 57% of men in Nigeria, that could not be adequate because most people don't go to hospital. That statistics could be more than that, but it's a good thing that
Wow,
we have
more than
something.
that?
It could be more than that. It could be more than
Wow.
that. I'm not in a position to say, but usually we say 50% of men have erectile dysfunction. Men. When we talk about men, we are talking of anybody above 18, one time or the other.
Wow.
But we've seen it early, but it's not common. Young men under 30, we've seen them, but that one is not common. But the ones we are seeing mostly now, men in their 30s,
Wow.
the lifestyle, if they take a lot of uh, alcohol, smoking, cholesterol, not going for exercise, Then when you take fatty meals, lifestyle is contributory to the younger men. But usually, naturally, by the time you are 40, 50, the integrity of the blood vessels become compromised. So the blood supply naturally, even without having any health issue. Most men that have erectile dysfunction, they don't have health issues. It comes naturally. That's why we need to talk about it. It's not a stigma. It's not a stigma at all. But
Okay.
in some health conditions, if you take 10 diabetic patients, then 10 diabetic who are men, you can be sure 7 or 8 have erectile dysfunction. If you take people with heart diseases, let's say 10 men, you can be sure 4 or 5 have erectile dysfunction. But usually with age, erectile dysfunction, the incidence increases. So if a
Wow.
man is 70, you have that chance, likelihood of the patient having erectile dysfunction. If a man is about 80, there's that likelihood that the man will have erectile dysfunction. So that is just it.
Okay, thank you very much.
Yeah.
When we get to the treatment, I will ask certain questions. But
Okay.
then coming to the home now, what
Hmm.
should be the response of the wives in all of this? When you, because the man himself will know and the wife too will know that there's erectile dysfunction. So what
Yes.
should be the response of the woman? How can she help a man in such a case?
Yes. That's a very good question. The man, to start with, should come out boldly to the wife, should come out clean to the wife that he has erectile dysfunction. Most men, because it's the self-esteem, they don't want the woman to know. They hide
But
it.
she will know anyway.
But she will know anyway.
Of
That's the
course.
truth. She will know anyway, but they should come out boldly that this is the problem. Now, to the wife should be very, very supportive. It is not that time that the woman should be antagonistic. It's not that time that the woman should, you know, not be supportive to the problem. The woman should talk to the husband and ask, what are the necessary things to do? They need to go to the hospital. You see, unfortunately, most men nowadays, they seek for self-help, and those drugs, they have side effects, they have their complications.
The
They
sex
don't,
enhancing drugs.
the sex enhancing drugs, yes. Some men take those drugs without the knowledge of their wives. I want to tell you that. They don't want their wives to know. So they take those drugs. That's what they see every time. They take those drugs without the knowledge of their wives, and those drugs they are harmful. If you go to government hospitals nowadays, the busiest clinics are the renal clinics.
Wow.
That is, people with kidney diseases, and usually the if you ask the history from patients why they have this kidney disease, they must have taken some drugs, either herbs, for one thing or the other. It might not be for erectile dysfunction alone. So people should be mindful of what they do or what they take. So the best approach is to go and see a physician if the man has erectile dysfunction. No need for self-help in this case, but the woman should be very supportive. Encourage the husband encourage the husband, tell the husband it's a natural thing, and thank God there's a solution to it now.
Okay. There is a solution or there are
Yes.
solutions.
Oh, there are
Okay, just
treatments.
just tell us what are the options available to the man.
Okay. Yes, the options available to the man with such a case are that when you go to the hospital, the doctor will see the patient, and then there are so many options for treatment. You have the drugs, which I will not mention. You have the drugs, You have the injectables, that is the injections to the male organ. You have the vacuum pump, and you have the prosthetics, implants. But there is a new technology now. All these ones I've talked about, they don't address the cause of erectile dysfunction. They don't treat, they don't cure erectile dysfunction. But there's a new modality for treatment. However, it's for only vasculogenic erectile dysfunction. That is
Okay,
the cause of
doctor, sir,
erection,
before we
erectile.
go on, hello, sir, before we go on to new technology, now you have mentioned that there are drugs, implants, injectables, and all that. Can it be reversed naturally? Because you mentioned that one of the causes of it is diabetes. Can, if the diabetes and hypertension, for example, is taken out of the way, will a man get himself back? Can it be
You said
reversed naturally? Even the older men, are there some things they can do naturally that will restore in the integrity of the blood vessels?
uh, your question is in two parts. You are
Okay.
asking whether the modalities of treatment I mentioned, whether those modalities can reverse effectively erectile dysfunction. Am I right? Is that what? Is that
Yes,
what
you
that was?
mentioned that there are drugs, there are injectables, fine. What I'm asking is, uh, does it also include natural remedies? Are there things naturally that the man can do without taking the drugs that could reverse erectile dysfunction and
Those,
restore the integrity of the blood vessels?
let me say something. What those modalities of treatment I've mentioned, they don't reverse erectile dysfunction to normal. If you have it, you take those things, it is only temporary. But however, let me go to your second part of the question. There are so many things a man can do that can help in the management of erectile dysfunction. In terms of diet, take a lot of vegetables, you avoid alcohol, you don't take cigarette, you avoid all these stimulants. 'Cause all these stimulants that these young men take, they really affect the integrity of the blood vessels. And then you engage in exercise. Exercise
Okay,
is very, very necessary. It
okay,
will help the blood flow to the pelvic region. So when you do exercise, you take a lot of vegetables, you avoid fatty meals, cholesterol intake. It helps in the management. However, to answer your question specifically, it does not reverse erectile dysfunction. It does not. It does not.
okay.
It
So
does not.
if all
Yeah.
those will not reverse it, are you saying this new technology can reverse erectile dysfunction?
It can only reverse vasculogenic erectile dysfunction. It's not all
Okay.
erectile dysfunction,
So
please.
you break
I
that
mentioned,
down.
yes, vasculogenic erectile dysfunction is that erectile dysfunction caused by, you know, problem within the blood vessels. Okay, because that's what we are talking about. And is the major cause of all the causes of erectile dysfunction, is a major cause. When you talk of hypertension, there's a problem with the supply of blood vessels because of hypertension. When you talk of heart diseases, there's a problem with blood supply to the male organ, because of heart diseases. When you talk of diabetes mellitus, there's a problem with blood supply to the male organ because of the problem. So it's a major problem. So that is the only one this treatment can address. If a patient has had um, prostate operation, prostate cancer operation before, he will not benefit from this therapy. If a patient has had pelvic injury, like accident, and then resulted into erectile dysfunction, he will not benefit from it. And let me just give you a scenario. We had a patient recently, a 42-year-old man who came in Unfortunately, he just heard about us. He came in. He came into the clinic. What happened to him was that he took these aphrodisiac drugs. One of them, I don't know. He himself cannot remember. So a couple of years ago, when he took the drugs, he had priapism. What we call priapism is that a patient has erection and it refuses to go down. So when that occurs, it becomes a surgical problem. So he was rushed to the teaching hospital in Lagos here. So what the surgeon will naturally do is to open up and release the clot. So at the end of the day, what happens? There's healing process there. That's what we call fibrosis. So the man now has permanent erectile dysfunction.
Wow.
Coming to us now, we cannot handle it. So I want to say it's not every case of erectile dysfunction. So this young man came in, was so pathetic, and because of this, he said he couldn't marry because he knows he has this problem. He didn't want to get married because of this. And having said that, I had to tell him, I counseled him that the way out, if he can afford it, is having prosthetics. So, but that is by the way. So the only solution we have is this new technology, which is already in Nigeria for vasculogenic erectile dysfunction.
Already in Nigeria, is it
Yes.
approved or is still at the testing stage? Has it been
Well,
tested? Is it
uh,
approved?
yes, I had an interview about 3 years ago on a television, and just like you asked me, the lady there specifically said she read, because on our website we put it there that not yet approved. That was 2019. So normally that is FDA approval. You need FDA approval, and for you to get FDA approval, it takes time. But we have it. We have FDA approval, which we got in 2020. But
Okay.
in Nigeria, as of today, a study has been carried out in University College Hospital, Ibadan. And the success rate, when you talk about efficacy and safety of shockwave therapy in ED patients in Nigeria using shockwave technology, they found out that the success rate is 86.4%. In that interview,
86.4.
yes, in that interview, I said the publication will be out. I said it's going to be around 90, but their own publication came out. They say it's 86.4%. So that is where we are as of today. It's approved by FDA. We've done clinical trials on it in UCH, and the results is fantastic, very significant. 86.4 in any studies anywhere in the world is highly significant. In fact, the research carried out in UCH was presented in New Orleans in May last month when we had our American Association of Sexual Medicine conference, because it is the reference point in black men. So it is the reference point that we are using the studies in UCH right now. So it is approved. I can say that
Okay.
in Nigeria.
Okay.
Yeah.
That's good to hear. And I'm sure
Yeah.
that the men who are affected and hearing this, they know that there's hope. It's
Yes.
not
Yes.
over.
Yes.
Now,
There is
sir,
so.
you have mentioned that this shockwave technology will not be able to help those that have the organic, right?
No. 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 I didn't say
Like
that.
those that are diabetic, hypertensive.
Most of the patients, our patients are mostly diabetic patients.
Okay, and it's
Diabetic
working
patients
for them.
is working for them, but it doesn't
Okay,
reverse the diabetes. It's erectile dysfunction you are talking about.
okay,
Don't get me wrong.
okay,
The shockwave therapy does not reverse their diabetes. It can only
okay.
reverse their erectile dysfunction.
Erectile dysfunction. Okay,
And we tell them to maintain healthy lifestyle after reversing their erectile dysfunction, and then to control their blood sugar very well. So
okay,
it's so simple. If the blood sugar is not well controlled, it will affect the integrity of the blood vessels. I
Okay.
will come into that. The way this therapy works is amazing. It's quite different because it creates new blood vessels. So new blood vessels are being created. It turns the man to a younger person. So
New
if,
blood vessels.
yes, absolutely, in the male
Okay.
organ, there's a process. What your body is supposed to do normally is what the machine triggers. It's your natural body response mechanism. It takes over. It's your body that takes over the therapy. So that's why we say
Is it like a surgery? Does it come
no,
with
no, no,
pain
no.
or
We say
anesthesia?
no. We say no pills, no surgery,
Mm,
no anesthesia, and
okay.
it's painless. No
Okay.
pills, no injectables, no surgery, no anesthesia, and it's painless.
Okay.
Most patients, they come from their working place and take the treatment and go back. So the therapy is not to reverse hypertension. It doesn't, please. It's just the ED. So if you're hypertensive, you take your drugs for high blood pressure. If you are diabetic, you take your drugs for diabetes, but it will reverse the erectile dysfunction. For the men who don't have any health issues, so it's a straightforward thing. So it just addresses
Okay.
the cause of
There,
the
there
problem.
are two questions that I will still want to ask you, and I want
Mm.
to ask all our viewers, if you are here with us, please, you have any question, put it in the comment section. Now, sir, will this help older men? Up to what age of men can this technology help?
Um, Let me say right away, there's no limit to age. Okay?
Hmm?
Yes, we have treated, I think, we have treated, but they don't come quite often. Men in their late 80s, 88. I think we've treated
Uh-uh.
one of 90. Yes,
Okay, sir. Men
90.
of
Yes,
80s.
yes. But
Oh,
let me say something
sir,
now.
okay, hold on, sir.
Eh,
I want you to just state it here.
yeah.
That is, there is no time that we say that a man is too old to have sex.
Yes, there's no time.
Okay,
Well, that is
okay.
what it's part of
So
the health of
I see.
of a healthy home. It
Okay.
is.
So
There's
you
no
are saying that this technology can help men of all ages,
exactly,
and
absolutely.
you have treated a man of 88 years old.
90,
Oh,
90, 90 in Nigeria.
in
About 2 years
Nigeria.
ago, we had highest as 86, but of recent we've
Somebody not me, or somebody will want to ask that what is Baba of 90 still looking for?
may I say that that is a
And the
relative
wife
question.
may be around 80 something too.
The wife might
Interesting.
not. I'm not. The wife might not be 80 something. The wife might not be 80 something, but some of them have younger wives. I will say that.
Okay.
Yeah, some of them have that. Let's be realistic. Some of them have younger wives. That is just the truth. So
Okay.
and they think so. It's they believe it's
Okay.
part of life.
It's
So we have men
interesting.
of the 80s.
So this new technology can help a lot of men. Is no surgery, no pills, it's painless. But is it pocket friendly?
It is very,
It's
But
pocket friendly.
yes, let me say something. I work with the manufacturing company to start with, and this particular company pioneered this technology, that is Medispec. They're using shockwave technology to treat erectile dysfunction. So, um, being a Nigerian, I let them know that we cannot, because the consumables are very expensive, because that is where the problem lies. The machine is there, expensive, but what the patient is going to take. But the company has been so friendly to us in Nigeria. At least they've subsidized the cost of the shocks that we apply, the cost. That is why right now, can you believe it? Nigerians now call us from outside the country.
Wow.
When they are coming home, they want to have the treatment because abroad, it's the cost is very, very high. At least over 300% or 400% of what the cost is in Nigeria. So that is just it's pocket friendly. It's pocket friendly.
Okay, but sir, you won't want to give us maybe a range, because
No, no, no,
I'm
no, no.
having
No,
some
no, no.
questions here that
No, 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 no,
do
no.
you want to tell us the cost?
Let me say something. I am working for the manufacturing company. Some hospitals have bought the machines. It would be wrong for me to start talking about the price the doctors are taking for the cost for the treatment. It will be very, very wrong. So it's when they
Okay.
go to the hospitals, they will tell them how much they take. So that is just it. But it is friendly in any way. It will be very
Okay,
wrong of me.
I'm going to go ahead to scroll your number. Is there any other thing that you want to add to everything that you have told us tonight?
Yes. What I would like to say is this. If any man has erectile dysfunction, it's not death sentence. And I'm happy it's not death sentence. There's a solution. There's hope. There's a new hope, which is this shockwave therapy. So, and I want to advise couples, the women need to be supportive at home to their wife, to their husbands when they have this problem. It is very, very important. So, and let them know that it is not good to go for self-help. If a man has erectile dysfunction, you should try as much as possible to visit the hospital, and then from there, the doctor will know the best thing to do.
Thank you. I have a question here.
I didn't say that lifestyle is a cause of erectile dysfunction.
Okay.
What I said is it's a risk factor.
A risk factor. Okay.
It's a risk. There's a difference between risk factor because if you take a lot of alcohol, if you smoke, you don't exercise, there's that tendency for you to be obese, and then when you have obesity, the integrity of the blood vessels could be compromised. So the lifestyle of a thing is very important, even after the patient has received the treatment, because like I said, new blood vessels are being created. That is the mode of that therapy. When you create those new blood vessels and you go back to smoking, you drink alcohol, then you don't exercise, of course, the risk factors will come back, thereby affecting the integrity
Of
of
the
the
blood
blood
vessels.
vessels. Please, I didn't say lifestyle is a cause. Because in medicine, when you are saying cause, you can identify that that's why I said organic and inorganic. But there are risk factors that can lead to erectile dysfunction. Yeah.
Thank you very much, Doctor. I'm going to add on Pastor Mrs. Oyedele. Maybe she has some questions for you before we round off for this evening.
Okay.
Hello,
Thank you
ma.
very much.
Hello, thank you so much, Dr. Oluranti. We are so
Yeah.
grateful for having you at the Orchard International. God bless you. I just
Thank
want to
you.
ask, is there any side effects to this technology, to this therapy? We need to
Okay,
know.
thank you, ma.
That is very, very important. Let me say, we pioneered this technology in 2010. So this technology has been in the market since 2010. Up to today, no reported side effects, no adverse effect to this. Like I said, it's your body natural body response mechanism that takes over what your body is supposed to do as a man. There are some enzymes that, usually there are stages for creation of blood vessels. But if by one way or the other, your body is not able to initiate that process, this machine initiates the process. So no side effect at all. If the publication has come out for UCH, efficacy and safety, and throughout the studies in UCH, no reported side effects at all, or in any of the patients. So that's a very good question.
Okay.
None.
Are you in all parts of Nigeria?
Presently, the machines are just in Lagos, but it's our intention to have the machines all over Nigeria, because it's a global thing. It's a global problem. It's supposed to be everywhere, because the protocol of treatment needs the machine to be very close to the patient, because it's not a one-off treatment. The
I
patient
see.
visits, yes, the patient visits the clinic 12 times. So if you are coming from
12 times within how many months?
within 2 months or 3 months, that is
Okay.
6 visits within 2 or 3 weeks. Then there's a break of about 4 to 6 weeks. There are another 6 weeks. You know, it's very painful when patients call from northern part of the country, even though some of them do come for the treatment, all the way from the north. But we know with time, the machines will be available in all the corners of Nigeria. But for now, we have the machines in about 4 centers in Lagos.
Thank you very much, Doctor.
Yes, my pleasure.
This is eye-opening, I believe, for many of the men that are watching us and those that will watch the replay. Thank you very much for coming on this program to tell us about erectile dysfunction, the causes, the effect of it on the man, on the marriage, and of course, the good news that there is hope, there's treatment available. We can't thank you enough, sir. God bless you, sir, for coming on this program. I'm going to hand over to Pastor
Thank
Mrs.
you very much
Modupe
for having me.
right now. Thank you
Thank
very
you
much.
very much for having me.
Okay, sir. You're welcome, sir.
Yeah.
Over to you, ma.
Thank you so much. We've learned a lot from our doctor. Doctor, thank you so much. We cannot appreciate you enough. And we believe that, this knowledge we've received tonight will go a long way to build relationship in the other room and even, within the husband and wife. Thank you so much. That the Lord honor you and reward you exceedingly. And we believe to have you soonest again, maybe on some other thing. But we'll also give testimony when you come back that things are happening better in the other room. God bless you, sir. Thank
Thank
you
you very
so
much.
much. We
Thank you very
appreciate you.
much. Thank you
Thank
Yes,
very
you
sir.
and
much.
thank you.
Thank you.
More
Thank
greater in Jesus' mighty name. God bless you,
Amen.
sir.
Amen.
Amen.
And our
Amen.
regards to
Amen.
the entire family over there.
Amen.
Thank you.
Thank you very much.
Amen. Thank you, sir.